In the elderly, health changes are often considered normal in the aging process. Prolonged fatigue, slight weight loss, or a dull pain are easily overlooked because they think that's just how old we are. However, this subjectivity causes many cases of cancer in the elderly to be detected too late, when the disease has entered a difficult-to-treat stage. This is not only a medical problem, but also a major challenge in terms of psychology and comprehensive health care for the elderly. In fact, the elderly are the group with the highest risk of cancer. According to statistics from the World Health Organization, WHO, more than 60% of new cancer cases diagnosed each year occur in people over 60 years old. This does not mean that old age is a death sentence, but it emphasizes the importance of early detection. Because early-stage cancer can be well controlled, even cured, while late-stage cases often face complex treatment options or palliative care. So, how not to miss the golden opportunity in cancer treatment for the elderly? The answer lies in careful and subtle observation of the smallest changes in the body. This video will point out 5 early warning signs that the elderly and their relatives are not allowed to ignore. Early detection, timely intervention, healthy and proactive living. That is what we can absolutely do to fight cancer from the first step. Unexplained weight loss, a silent sign of many dangerous diseases. Unexplained weight loss is one of the most silent but worrying warning signs, especially in the elderly. In many cases, unintentional weight loss, that is, without dieting, exercising more, or changing your lifestyle, is an early sign of serious medical conditions, including cancer. For older adults, losing a few pounds may not be immediately noticeable, but rapid weight loss without an obvious reason is a cause for concern. Specifically, if a person loses more than 5% of their body weight over a period of 6 to 12 months without making any changes to their diet or activity level, it is considered abnormal. For example, if a person who weighs 60 kilograms loses more than 3 kilograms over a period of several months without knowing why, it is no longer natural weight loss. In older people, this is even more important because the body is no longer as flexible as in younger people, and sudden weight loss can quickly lead to weakness, loss of muscle mass, reduced resistance, and worsening of existing diseases. There are many causes that can lead to unexplained weight loss. One of the serious and often overlooked causes is cancer. Many types of cancer, such as stomach, esophageal, pancreatic, lung, or colorectal cancer, can cause loss of appetite, nausea, indigestion, or cause the body to burn energy abnormally. In this case, even if the patient still eats normally or even eats more, the patient still loses weight rapidly. In some cases, weight loss is the first sign before other symptoms, such as pain, cough, shortness of breath, or fatigue appear. In addition to cancer, endocrine diseases such as hyperthyroidism can also cause rapid weight loss, accompanied by palpitations, rapid heartbeat, insomnia, hand tremors, and feelings of restlessness and anxiety. People with diabetes, especially type 1 or early stage type 2, can also lose weight suddenly because the body cannot use glucose and must switch to burning fat and muscle for energy. In addition, chronic gastrointestinal diseases such as ulcerative colitis, Crohn's disease, or malabsorption disorders also contribute to weight loss that the patient sometimes does not immediately realize. In terms of psychology, depression is a common cause of weight loss in the elderly. People with depression often lose interest in eating, sleep poorly, feel tired for a long time, and gradually lose weight silently. In addition, loneliness, anxiety, or cognitive disorders can also change eating habits in the elderly, causing them to eat less without realizing the consequences. So, unexplained weight loss is not something to be taken lightly, especially if it happens quietly and for a long time. If you or a loved one is experiencing unexplained weight loss, especially if it is accompanied by other symptoms, such as fatigue, persistent low-grade fever, cough, changes in digestion, or unusual aches and pains, see your doctor for a full checkup. Early detection of the cause behind the condition can lead to timely treatment, improve quality of life, and sometimes be the difference between survival. 2. Chronic fatigue, when exhaustion is no longer normal. Fatigue is a feeling that everyone has experienced in their daily lives. In the elderly, it is understandable to feel tired after a day of housework, taking care of grandchildren, walking, or when the weather changes. However, what is worrying is when the feeling of fatigue becomes a permanent part of life. Despite resting, getting enough sleep, eating normally, the body still feels lethargic, lifeless, and gradually loses the ability to concentrate or perform the simplest tasks. It is no longer fatigue due to old age, but can very well be an early warning sign of a serious health problem, including cancer. Chronic fatigue of unknown cause is one of the silent but common symptoms of many types of cancer, especially blood cancers, such as acute leukemia, lymphoma, colorectal cancer, stomach, liver, and lung cancer. In these diseases, the body may become anemic due to the affected bone marrow, microscopic blood loss through the digestive tract, or due to cancer cells secreting inflammatory substances that disrupt metabolism and deplete energy. As a result, even though the patient still maintains the same lifestyle as before, they will feel more tired than usual, often sleepy, easily out of breath when doing light work, and no longer have the strength to do activities like before. In the elderly, sometimes the feeling of fatigue is overlooked because they think this is how old people must be. This is very dangerous because it can delay the diagnosis of the disease. An elderly person who used to like walking, taking care of plants, cooking, but suddenly loses interest, just wants to lie down or sit all day because of unexplained fatigue. That is something that needs to be closely monitored. Prolonged fatigue can also cause the patient's mood to change, making them irritable, bored, and even depressed. In many cases, this is a vicious cycle. Illness causes fatigue, fatigue causes low morale, and low morale makes fatigue worse. In addition to cancer, other conditions that can cause chronic fatigue include anemia, hypothyroidism, heart failure, chronic liver or kidney disease, or an underlying infection. However, the common thread is this. If fatigue lasts for weeks, does not improve despite getting enough sleep, eating a healthy diet, and has no obvious cause, such as overwork or lack of sleep, it is time to see a doctor. This is especially important for older people, whose ability to self-assess their health may not be as good as it once was. They may not realize that their energy levels are decreasing, or they may assume that the changes are natural with age. Therefore, relatives and caregivers need to be alert to detect small changes in daily routines, such as sleeping more, eating less, no longer wanting to go out, or needing to take breaks from doing things that were previously possible. Persistent fatigue is not something to be ignored, especially when it is the only symptom that appears early in many types of cancer. Timely medical examination, blood tests, thyroid function tests, gastrointestinal endoscopy, or imaging, depending on the indication, will help find the cause and intervene early if necessary. In the treatment of cancer and chronic diseases, early detection almost always brings a better prognosis and a higher chance of recovery. Point 3. Prolonged cough, hoarseness, or difficulty swallowing. Signs that are easy to ignore but should not be ignored. Coughing is a natural reflex of the body, helping to expel irritants or foreign objects from the respiratory tract. However, if the cough lasts for more than 3 weeks without improvement, especially in the elderly, it is no longer a cough due to weather changes or common sore throat. Chronic cough, prolonged hoarseness, or difficulty swallowing can be an early sign of a number of serious diseases, including cancer of the respiratory tract or upper digestive tract. The worrying thing is that these signs are often overlooked, leading to late detection of the disease. In the elderly, changes in voice or a feeling of choking when eating and drinking are sometimes attributed to aging or weakening of the throat muscles. But in fact, it can be an early manifestation of cancer of the larynx, hypopharynx, esophagus, or lung. These diseases often progress silently, without causing obvious pain in the early stages, but manifest as minor symptoms such as persistent hoarseness, persistent cough, coughing up blood-tinged sputum, sore throat on one side, feeling of a foreign body in the throat, or difficulty swallowing, especially with solid foods. Hoarseness lasting more than 2 to 3 weeks without obvious cold symptoms should be evaluated by an ENT specialist. The cause may be chronic laryngitis, polyps, or benign tumors of the vocal cords. However, in some cases, especially in people who have smoked for a long time or have been exposed to polluted environments, persistent hoarseness can be an early sign of laryngeal or nasopharyngeal cancer. Laryngoscopy can help detect early abnormalities in the vocal cords and throat area, where cancer is likely to develop but is often overlooked because it does not cause obvious pain or discomfort at first. A persistent cough, especially a dry cough or a cough with bloody phlegm, is also a notable sign. This can be an early symptom of lung cancer, one of the most common and deadly cancers in older adults. Many people initially experience only a mild cough, feeling like an allergy or sore throat, but this symptom persists despite taking antibiotics or common cough medicine. Over time, the cough becomes worse, especially at night, or is accompanied by difficulty breathing, chest tightness, and unexplained weight loss. Difficulty swallowing, also known as dysphagia, is a common sign of esophageal cancer. At first, the patient only feels a slight obstruction when eating hard foods such as meat, rice. Then it progresses to the point of difficulty swallowing porridge, soup, or water. Because this change occurs slowly, many people do not notice or think they have a sore throat, tonsillitis, or weak teeth, not chewing thoroughly. But if the difficulty swallowing persists and gets worse, it is a clear sign that you need to see a doctor to rule out the risk of cancer. It is important not to wait until you have severe pain or significant weight loss to see a doctor. Symptoms such as persistent cough, hoarseness, or difficulty swallowing, which may seem simple, can be the earliest warning signs your body gives you. Detecting cancer at an early stage not only increases the chance of successful treatment, but also minimizes invasive treatments and improves your quality of life later on. Older adults should take the initiative to have regular checkups and not ignore small changes in their bodies, because those small changes can sometimes have great significance. Point 4. Unusual changes in skin or moles. Don't ignore the smallest signs on your skin. The skin is the largest organ in the body and is also the place where many health-related abnormalities can be detected early, including cancer. In the elderly, the skin is often thinner, drier, and more prone to dark spots, wrinkles, and dents due to the natural aging process. However, not all changes on the skin are normal. There are signs that seem very small, such as a new mole, a dark spot that does not heal, or a patch of peeling skin that lasts for a long time. That can be an early sign of skin cancer. If not noticed and detected promptly, these signs can be overlooked for months, even years, before the disease progresses to a serious stage. One of the most dangerous types of skin cancer is melanoma. Although this type of cancer is not as common as other types of cancer, it has the ability to metastasize very quickly, and once it has spread to other organs, the prognosis is often poor. The good news is, melanoma can be detected very early just by observing changes on the skin surface, especially in older people who are at higher risk of skin cancer due to the accumulation of ultraviolet UV exposure over many years. Regular skin checks are more important than ever. It is important to remember that not all moles are dangerous, but if a mole or patch of skin is asymmetrical in shape, has irregular borders, is patchy in color, black, brown, red, blue, is larger than 6 millimeters in diameter, or changes over time, these are very suspicious features of cancer. This is called the ABCD, principle of identifying abnormal moles, and is a useful tool for people to check themselves at home. In addition to melanoma, older adults are also susceptible to basal cell carcinoma and squamous cell carcinoma, the two most common types of skin cancer. These types often appear as small, non-healing sores, red patches with scaly flakes, small, shiny surfaced lumps, or nodules that bleed when touched. They often appear on exposed skin such as the face, neck, ears, and arms, areas that are frequently exposed to the sun for many years. Although they rarely metastasize, if not treated early, they can invade locally, causing disfigurement or serious damage. Another problem for older adults is that the ability to self-examine the skin may be limited due to poor vision, difficulty bending, or not paying attention to hidden areas such as the back, scalp, and back of the legs. Therefore, regular skin examinations, even once a year, with a dermatologist are a simple but effective way to screen for risks early. Relatives can also help the elderly check hard-to-see areas of the skin during daily activities. If you find any strange spots on the skin without a clear cause, or see a mole that is growing every day, itching, oozing or changing color, take the initiative to see a doctor. A skin biopsy, taking a small sample for testing, is a simple, quick, and usually painless procedure, but can provide a decisive diagnosis for early and effective treatment. In short, do not ignore any changes in the skin, especially in the elderly, because it can be the earliest warning that the body wants to send you. Detecting skin cancer at an early stage often results in simple, minimally invasive, and highly effective treatment. You just need to observe carefully, be vigilant, and act promptly. 5. Unusual changes in defecation or urination. Silent signals that need special attention. In daily life, going to the toilet seems to be a normal activity, often overlooked, especially in the elderly. However, small changes in bowel or urination habits can be silent signs of many serious health problems, including cancer. Many people think that constipation, irregular diarrhea, urinary incontinence, or frequent urination at night are just symptoms of old age, or due to improper diet. So they often buy medicine to use themselves or try to endure for a long time. That is why many diseases, especially colorectal cancer, bladder cancer, or prostate cancer, are missed in the early stages, when treatment is still easy and effective. One of the typical and highly alert symptoms is a change in bowel habits that lasts for a long time, such as more frequent constipation, alternating with diarrhea, feeling like you haven't finished defecating, stools that are smaller than normal or have an unusually flat, distorted shape. In the elderly, these changes can be caused by many reasons, such as eating less fiber, not drinking enough water, being sedentary, etc. However, if the condition lasts for more than 2 weeks and does not improve despite adjusting your diet or taking regular medication, you need to be examined to rule out colorectal cancer, one of the most common cancers in people over 60 years old. Another important sign is blood in the stool, even if it is only a little mixed in or only seen when wiping toilet paper. Many people confuse this phenomenon with hemorrhoids, a common benign disease in the elderly. However, the difference here is that blood from cancer is often mixed in the stool, dark or dark brown, accompanied by an unusual odor, while hemorrhoid blood is often bright red and drips after defecation. In addition, prolonged fatigue, pale skin, dizziness accompanied by dark stools can be a sign of chronic blood loss, an indirect manifestation of bleeding from a tumor in the large intestine that the patient is unaware of. In the urinary system, changes such as painful urination, frequent urination, nocturia more than 2 times per night, blood in the urine, or weak urine stream should not be ignored. Especially in older men, this can be an early sign of prostate cancer, the most common cancer in men over 65 years old, because the prostate is located just below the bladder and surrounds the urethra. When a tumor develops, the patient often has difficulty urinating, frequent urination, intermittent urination, or incomplete urination. If you have blood in your urine, even just once, you should see a doctor immediately for an ultrasound, PSA test, or biopsy if necessary. Older women should not ignore changes in urination. Urinary disorders accompanied by pain in the lower abdomen, blood in the urine, or difficulty controlling urine can be early signs of bladder cancer or widespread gynecological cancer. These changes are often overlooked or dismissed as complications of menopause, but early detection can completely change the prognosis. It is important for older adults and their loved ones to listen to their bodies and monitor their daily habits. Any change in bowel habits, no matter how small, is a good reason to see a doctor. Colonoscopy, abdominal ultrasound, urine and blood tests are simple, non-invasive methods that can help detect suspicious lesions early. In many cases, detecting the disease before symptoms appear not only saves the patient's life, but also helps maintain the quality of life, avoiding complicated and painful treatments later. Unusual changes in defecation or urination, silent signals that need special attention. In daily life, going to the toilet seems to be a normal activity, often overlooked, especially in the elderly. However, small changes in bowel or urination habits can be silent signs of many serious health problems, including cancer. Many people think that constipation, irregular diarrhea, urinary incontinence, or frequent urination at night are just symptoms of old age, or due to improper diet. So they often buy medicine to use themselves or try to endure for a long time. That is why many diseases, especially colorectal cancer, bladder cancer, or prostate cancer, are missed in the early stages. When treatment is easy and effective. One of the typical and highly alert symptoms is a change in bowel habits that lasts for a long time, such as more frequent constipation, alternating with diarrhea, feeling like you haven't finished defecating, stools that are smaller than normal or have an unusually flat, distorted shape. In the elderly, these changes can be caused by many reasons, such as eating less fiber, not drinking enough water, being sedentary, etc. However, if the condition lasts for more than 2 weeks and does not improve despite adjusting your diet or taking regular medication, you need to be examined to rule out colorectal cancer, one of the most common cancers in people over 60 years old. Another important sign is blood in the stool, even if it is only a little mixed in or only seen when wiping toilet paper. Many people confuse this phenomenon with hemorrhoids, a common benign disease in the elderly. However, the difference here is that blood from cancer is often mixed in the stool, dark or dark brown, accompanied by an unusual foul odor, while hemorrhoid blood is often bright red and drips after defecation. In addition, prolonged fatigue, pale skin, dizziness accompanied by dark stools can be signs of chronic blood loss, an indirect manifestation of bleeding from a tumor in the large intestine that the patient is not aware of. Old age is a stage when the body goes through many changes, and many people tend to ignore unusual symptoms because they think it is normal. However, as you have seen, 5 seemingly familiar signs, such as unexplained weight loss, prolonged fatigue, persistent cough or hoarseness, unusual skin changes, or bowel and bladder disorders, can all be early warnings from the body about dangerous diseases, such as cancer. It is worth noting that these signs are often ignored or self-treated at home, leading to late diagnosis and reduced chances of successful treatment. Remember, early detection of cancer can save your life. Many types of cancer are completely curable if detected and treated in the early stages. So if you or a loved one is experiencing one or more of the above signs, do not hesitate to go for a checkup. An appointment with a doctor today can make a big difference to your health tomorrow. Backhand index pointing right. Take action now. Schedule regular health checkups. Talk to your doctor when there are unusual signs. Encourage your loved ones to care about their health. Backhand index pointing right. Share this information with the elderly around you, because health is not just a matter of one person, but a shared responsibility of the whole community. Live proactively. Live healthy. Live fully every day.